My name's Pam Lauer. I'm one of the nurse practitioners in the outpatient clinic, and I'm here today along with Avery, LaFleur, who's a clinical care manager here at Craig Hospital, and we're here to discuss male sexual functioning after spinal cord injury. Our goal for this discussion today is to talk about what may not be working as well in terms of sexual functioning after spinal cord injury, also to talk about what we can do to improve sexual performance and to improve your overall experience, sexual experience, and emotional experience. Of course, every spinal cord injury is different, and what works for one person, even at the same level of injury, may not work for another. Some people also are not healthy enough for sexual intercourse, and some people's hearts are not healthy enough for sexual intercourse. So please discuss options with your healthcare provider prior to trying any of the options that you're seeing here today. The first step is to understand erections and understanding how an erection occurs. So erections occur both by nerve stimulation and blood flow response. After sexual stimulation or touch of the genital areas, the arteries of the penis will enlarge and blood will be trapped in the sinusoids of the penis as the smooth muscle relaxes, and then the veins compress, and that helps to trap blood in the penis. So on this slide, you'll see the corpus cavernosum in that area. So that's the muscle of the penis. In that area are also those arteries which are dilating to get the blood flow into those muscles. There are different types of erections. The first type of erection is what we call psychogenic, and this is the type of erection that's going to come from sexy thoughts. So something that we see that's arousing, sounds or thoughts, or seeing someone that you find sexy. There is an area of the spinal cord that's responsible for these erections, for these psychogenic erections, and that's located between the areas of T11 and L2. So if your spinal cord injury level is above this, those messages or those sexy thoughts from your brains can't get through the damaged part of your spinal cord, and it's likely that you would not be able to get this type of erection. So after injury, those men, T10 and lower, may be able to get a psychogenic erection, and often in these cases, the penis will get longer and maybe more full, but it's difficult to say that they would be rigid enough for intercourse. That would be person to person. There's also what we call a reflex or a reflexogenic erection. This type of erection is a direct result of physical touch or stimulation, and that causes a reflex for the erection to occur. This is not connected to sexual thoughts. The ability to get these erections, this is also called a spontaneous erection, is controlled by nerves found in those lowest spinal cord segments, the S, 2, 3, and 4. So these erections from touch, again stimulating that reflex, are possible in most men T10 and above. These are going to be what we consider more in the upper motor neuron category of spinal cord injuries. However, although these erections can occur at stimulation, they can sometimes be quick and sometimes can happen at times that are very inconvenient, at bathing, but also sometimes in the chair when someone is repositioning. There's also something called a nocturnal erection or spontaneous erection. This is what we think of as if you've ever woken up with erection first thing in the morning or at night without stimulation. These usually occur when you're in deep sleep, or what we call REM sleep. With men that don't experience erectile dysfunction, these can occur often throughout the night, 3 or 5 times on average. Some people after spinal cord injury can still get these erections. These are more chemically mediated. This is a nitric oxide kind of reaction in your body. And depending on how long that erection lasts, determines whether or not it would be helpful in terms of usefulness for sexual activity. There are a lot of men with erectile dysfunction. Most spinal cord injuries, however, have those intact S2 to S4 nerve segments, and that means that those reflex erections are very likely to occur. However, again, as we discussed, they can occur at times that maybe are not convenient. Maybe your mother's doing your catheter care and notices that you're getting an erection. They can vary in terms of fullness and sometimes don't last very long. There are other things that can cause erectile dysfunction outside of spinal cord injury. You can see a lot of the other options or other things that can cause erectile dysfunction on this slide, such as diabetes, medications, specifically things like opiates, obesity, cholesterol deposits in the arteries leading into the penis, depression, some medications for depression, tobacco use, alcohol use, treatment of prostate cancer, and multiple sclerosis. There are other things that can cause erectile dysfunction, but these are some of the main issues. When these are combined with spinal cord injury, it can be even more difficult to treat. So how can we help? As you can see here, there are lots of options that can help with erectile dysfunction. What's appropriate for you will depend on what type of erection you have going into it, into these interventions, if any. The first option is simply a constriction band or ring, or what we would think of as a cock ring. These have been used in some forms since 1775. However, they work well if patients are able to achieve a pretty firm reflex erection. If the erection is soft, it's just going to trap what blood is already in the penis. These rings tend to be pretty cheap and are reusable. There are a lot of options. Some can be kind of adjustable, like a bolo tie style, or leather Velcro. Some work well with the vacuum erection device. They also are made with and without vibration. My suggestion would be to avoid metal rings and to make sure that these are removed at 20 minutes to ensure that you're getting enough blood flow to the penis, 20 to 30 minutes. And that you're not causing any damage. If you do leave on the ring for too long, if you fall asleep with these on, it can cause issues such as swelling of the penis, which can make the ring more difficult to get off, or scrotum, if you're including the scrotum in the ring or the constriction. But the worst case scenario would be that you could lose blood flow to the penis and you could cause damage of the penis itself. The next option are vacuum erection devices. So this is what we think of as a penis pump. The penis pump will pull blood into the penis, but they do need to be used with a constriction band to hold blood there. There are several options for the devices. There are manual, there are battery operated. The ones that tend to have good pressure, good suction, and are easy to use generally cost somewhere between $125 and $250. However, in a study of about 20 men that had spinal cord injury that used these vacuum erection devices to obtain erections, at about 3 months, 93% of the men reported that they did have enough rigidity with use of the vacuum erection device. However, at 6 months, about 41% of the men were satisfied with the device. And the reason for that was that a lot of men found that they lost the erection half or part of the way through intercourse and had to pump back up and reapply the ring. And that can be somewhat inconvenient. So it does work well for some men, but is not appropriate for everyone. The next options are the medications. These are in a category of medications called PDE5 inhibitors. And these are things that we think of like Viagra, the generic being sildenafil, Cialis, Levitra, Staxin, or Stendra. These medications work in two different ways. They actually block an enzyme, which is that PDE5 or phosphodiesterase 5, that is the off switch for erections. So that's one way that they work. They also help relax that smooth muscle of the arteries to bring in more blood flow. Medications can work quite well in people that don't get fully erect or don't have those good reflex erections. However, as with all medicines, they do have side effects. One of the side effects is priapism, and that's that the penis could stay erect for too long. Another common side effect with these medicines is headache, nasal stuffiness. You can get a little bit of a flushed feeling. They can cause low blood pressure. And rarely, but it can happen with Cialis, it can cause a backache. These medications don't work well when they're eaten with fatty foods, such as if you went out for a burger and fries. These medications wouldn't work quite so well to help you obtain an erection. It would take you longer to digest, and they likely would not be as effective. They also should not be used with any nitroglycerin products, such as the nitroglycerin ointment that we commonly use for autonomic dysreflexia. This could cause a very unsafe drop in blood pressure, and those medications should not be combined. Occasionally, these medications will work to help get the erection to be firm. Occasionally, we will use these in combination with the ring if it just doesn't last quite long enough. In terms of cost, a lot of times what we will also do is use some cost savings apps, such as the GoodRx app, which can help with finding local pharmacies that have cheaper prices for these medications. The next option is a Muse. The Muse is a urethral suppository of alprostadil, which helps pull blood into the penis. So the Muse it's very small suppository. It has a little applicator that you would insert into the end of the penis and squeeze, and it would leave that little suppository in the end of the penis. The Muse is expensive, so $378 for 6 at this point in time, and works about 33% of the time. But it is an option for some people that the oral medications aren't working and possibly the injections are too much, or they are just really resistant to consider injections. The next options are penile injections, or what we call intercavernous injections. Injections can be done with any combination of 1 to 4 medicines. These medicines we inject directly into the muscle of the penis, and there are 2 muscles that kind of run side by side up and down the shaft of the penis. The medicines will increase, well, there are 2 of the medicines that increase blood flow into the penis, and one particularly that kind of helps trap it there. The good thing about the injections are they tend to be very effective. They work after adjustment in almost everyone, upper motor neuron or lower motor neuron, and it tends to be highly adjustable. You can inject once in a 24-hour period, no more than 3 days per week. Injections, however, do increase the risk of priapism, which is the erection lasting too long. Also, because you're doing an injection, there's more risk of bruising, bleeding, infection because you're breaking the skin, and you can get some scar tissue on the penis from repeat injections. Once the medications are mixed, such as Trimix, which is a combination of 3 medications that tends to work well for a lot of men, it has to be refrigerated. This is a video that will show you the procedure for an injection. When you want to do a penile injection, the first step is to gather your supplies. You're going to need a sterile syringe, you're going to need alcohol wipe, you're going to need the medication. The first step is to wash your hands. The medication needs to be thawed. You need a new sterile syringe for each injection. And the first step is going to be drawing up the medication. You want to clean the top of the vial with alcohol, and you inject air into the vial, drawing back just more than the medication amount that you need. Make sure there are no air bubbles, and draw the appropriate amount of medication. If you're not going to be using it immediately, you can recap the syringe. Then you're going to inject in the upper third of the penis on either side. The top of the penis have nerve bundles that runs down through the center. There are 2 tubes of muscle on either side, and the underside is more of the urethra, where you pee out of. Prior to injection, you want to look and try to avoid any surface veins that may be present. You want to clean off whichever side you're going to be injecting with alcohol. Uncap the needle. You want to hold it somewhat like a dart. Again, you're going to be injecting in the upper third of the penis, not towards the head of the penis. You do inject all the way in. The medication should go in easily, and then you hold pressure for 3 minutes if you're not on any blood thinners, and for 5 minutes if you are. The medications that are often used in injections are alprostadil. The other name for that is prostaglandin, phentolamine mesylate, papaverin, and occasionally we will add atropine if mixtures of the other 3 are not working well. Once these medications are mixed, they do need to be refrigerated. In the refrigerator, they typically last somewhere between 1 and 3 months, if kept in the freezer, occasionally can last up to 6 months. There are 2 types of alprostadil-only injections that are available commercially in powder form that you mix at the time of use. Those are Caverject and Edex. They tend to be good for travel because they don't have to be refrigerated but can be quite expensive. The other medications, when they're mixed, will have to be prepared at a compounding pharmacy for sterile injection. Those aren't available everywhere, but are common in larger cities. And the cost can vary from pharmacy to pharmacy, but averages somewhere between $80 and $120 for approximately 2.5 milliliters. So cost can vary. The potential side effects for injections, again, that erection that lasts too long, which is priapism, skin infection, bruising at the injection site, bleeding at the injection site, scarring of the penis, and pain at the injection site occasionally can be felt as a burning sensation when the medication is injected. The last resort option for erectile dysfunction is a surgical implant. This is typically a 3-piece, what we call penile prosthesis, where there are 2 cylinders that are implanted where the muscle of the penis would usually sit, that are attached to a button or a pump bulb in the scrotum. And then that's attached to a reservoir of saline, which sits up kind of in the suprapubic region, kind of where the bladder sits. When you want to get an erection, you click the button in the scrotum, and the saline, due to the pressurized system, is pushed up into the cylinders of the penis. The good thing is that you can get an erection at any point without taking any medications. However, once the cylinders are placed in the muscle of the penis, this causes structural damage, so you cannot go backwards to try to achieve erection spontaneously without the device or with other methods. In spinal cord injury, there's an increased risk of what we call penile erosion, which is where this device can come through the skin. There's always a risk of device failure, which means that one of the connectors could come apart, which means that they would have to go in and surgically repair that. However, these devices do provide a very predictable, very natural feeling, and very natural looking erection.
I'm Avery LaFleur, and I'm with Clinical Care Management at Craig Hospital. The next part of this discussion discusses the search for enjoyment and pleasure with sex after an injury. Sexual pleasure is possible after a spinal cord injury. There are many parts of your body which can be aroused and provide a pleasant sexual response. These areas of the body are called the erogenous zones and are not limited to the genital area. Exploring areas where one has sensation and then moving to areas of little to no sensation is a good place to start. Instead of focusing on what the penis can and cannot do, try experimenting with all of your senses, being in the moment and allowing yourself to not focus so much on how you are performing. Your specific ability to have an orgasm after SCI is unknown, but many people report they are able to have some form of orgasm after an injury. Orgasms have been described differently amongst individuals. So how that orgasm will feel or how your body will react is really up to you to explore and find out. Using your senses is an important tool. Smell, taste, hearing, touch are all important factors to being successful with intimacy. Listening to music, lighting, scented lotions, using your imagination is also a powerful aspect to consider. Consider watching your partner touch themselves or touch you where you may or may not be able to feel. Taste can be arousing with kissing or oral stimulation. Some people report heightened sensitivity in areas where they can still feel. Explore touch on the head, necks, lips, arms, or nipples. Although vibration is commonly used for fertility purposes, which will be discussed in a separate segment, they can be useful to provide stimulation and achievement of ejaculation and orgasm for many. Using devices and vibrators may require some modification for people with limited mobility, especially with upper extremity functioning. These can be costly items, however. Some vibrators have been created specifically for achieving ejaculation in spinal cord injury for fertility purposes, such as the Ferticare or the Vibrorect. Examples of vibrators that are more commonly available for exploration and stimulation are the Fairy Wand, the Pulse 3, the Magic Wand, and the Wall Massager. Be aware, the use of vibration can put you at risk for autonomic dysreflexia. Speak with your provider before using vibration to discuss how to evaluate and manage autonomic dysreflexia. Autonomic dysreflexia is a rise in blood pressure resulting from a stimulus below your level of injury. You are at risk if you have an injury at T6 and above. You may want to discuss AD with your healthcare provider prior to having sex to develop a plan in case it occurs. Discussing with a healthcare provider is important. If your AD does not resolve, you should contact your doctor or call 911.
During AD, the discomfort below your injury turns on autonomic nerves that trigger your blood vessels to squeeze tight, forcing your blood pressure to rise. If your blood pressure is between 20 and 40 points higher than normal, then you may be experiencing autonomic dysreflexia. Your brain senses this and sends signals back through your body, trying to lower your blood pressure. At the same time, your brain sends a signal to your heart, telling it to slow down. The messages sent from your brain to the blood vessels in your face, neck, and upper chest can make you look flushed or blotchy. Your brain tries to tell the blood vessels in your legs and abdomen to stop squeezing, but again, your injury has blocked those messages. So, your blood vessels keep squeezing and your blood pressure can continue to rise. If this is not stopped, it can lead to seizure, stroke, and even death.
Some considerations with bowel and bladder management one may want to address prior to sex are being sure your bladder is emptied. If you have a suprapubic catheter, it can be gently taped to the lower abdomen to keep it out of the way and prevent any pulling. Stick to a regular bowel program and ideally be sure bowels are emptied prior to sexual activity if possible. Position your pelvis in an upward tilt if on your back, both to aid in penetration and to keep pressure off the bladder and lower bowel. Always be aware of your skin. Damage to skin from shearing, pressure, and rubbing can happen during sexual activity. Padding and positioning are very helpful in avoiding new sores. Monitor your skin for redness and injury and remove pressure if anything develops. Using plenty of lubrication and being sure to wash and dry the genital area with soap and water before and after sexual activity is appropriate. And don't forget, all men should have regular exams of the penis, prostate, and testicles yearly to monitor for any changes. When calling to schedule an appointment, ask if the office and examination table are wheelchair accessible and if staff members can assist with transfers, positioning, and preparation for the exams. Remember, sexually transmitted diseases are still possible, so use protection.